So good evening, Devinder. Just
Good
formally.
evening, namaskar everyone. My warm
Namaskar.
regards
Namaskar,
and
sir.
namaskar to everyone. I've been hearing so much from Srinivas Bhai about Sunil Biswalji and Dr.
अरे वाह
Sarojini Sahu. I'm unable to recognize everyone else, but it is such a huge pleasure on my part to be with you this evening. And
Dr. Devendra, we are equally elated to have you today.
it's your graciousness. It's your graciousness.
ଆଜିର ପ୍ରୋଗ୍ରାମ ହେଉଛି ଆମର ସେକେଣ୍ଡ ଦିନ ସାଇନ୍ସ ୱିକ୍ ସପ୍ତାହ ଯୋଉ ନ୍ୟାସନାଲ ସାଇନ୍ସ ୱିକ୍ର ସେକେଣ୍ଡ ଦିନ ସେକେଣ୍ଡ ସେସନ୍ ଆଣ୍ଡ ସୁନୀଲ ବାବୁଙ୍କୁ ମୁଁ ଅନୁରୋଧ କରିବି ସିଏ ଆଜିର ପ୍ରୋଗ୍ରାମଟାକୁ ମଡରେଟ୍ କରିବେ। Anyway, with us already, he himself has introduced Devinder. सुनील बाबू ताको विषय भी कहिबे आ मॉडरेट करिवे आगो को बढ़ेबे डिस्कशन टाको वी आर एक्चुअली माने एक्साइटेड enthusiastically waiting for this hour.
Thank you, Srinivas bhai. Thank you. All the participants who have joined today's online seminar on delving deeper into digestive system, I wish them all, I extend them a hearty welcome from Vigyan Chetana Mancha. We are holding this online seminar as a commemorative lecture on occasion of National Science Week, Jatiyo Vigyan Saptaha अवकाशरे आज जो आमर जो टॉक अच्छी पाचन प्रणाली विषय टिके अधिक माने गभीर अध्ययन एवं टुडे स्पीकर इज डॉक्टर देविंदर सिंह, renowned gastroenterologist of our country, right now working as consultant at Apollo Hospital, रायपुर छत्तीसगढ़। आज ये विषय आमको सूचना देवाई आम सौभाग्य जे आम गहण अच्छा डॉक्टर देविंदर सिंह जी की जड़े स्वनामधन्य गैस्ट्रोएंटरोलॉजिस्ट एवं वर्तमान सी छत्तीसगढ़ राज्यर रायपुर रे अपोलो हॉस्पिटल जड़े कंसल्टेंट हिसाब से काम कर। डॉक्टर देविंदर इज ए चाइल्ड ऑफ राजगंजपुर, so happy to know that as he has born there and had his education there too. He is also a kind of a polyglot who can speak in Hindi, English, Odia, Sambalpuri, Chhattisgarhi, Sadri and Gurmukhi. It is a very uncommon trait to come across people having this particular trait. I'm really happy that today's participants should be able to ask their questions in whatever language they feel comfortable in, and they will get their answers in the same language. Dr. Devinder तांकर पिलादिन राजगंजपुर कटिची एवं सी जड़े बहु भाषा विषय बहु भाषा कही पारथुवा जड़े व्यक्ति जेमिति कि हिंदी, इंग्लिश, ओडिया, संबलपुरी, छत्तीसगढ़ी, साद्री एवं गुरुमुखी। तो मु आशा करछि तांकर एई जो प्रतिभाटा को आज आमर एई ऑनलाइन सेमिनार रे जो देउथबा समस्त व्यक्ति विशेष एवं छात्र छात्री समस्ते संपूर्ण भाव व्यवहार करेंगे एवं निजे जो भाषा से कंफर्टेबल फील करछन्ती सहज अनुभव करछन्ती सेही भाषा से प्रश्न पचारे एवं सेही भाषा से उत्तर मध्य पाइबे। Dr. Devendra is founder member of Oxygen, a NGO that has impossible accomplishments to its credit, that of bringing back a dead river to life near Bilaspur, which is again in Chhattisgarh. This NGO is working towards issues pertaining to environment. He has been a policy influencer for the local governments to make it mandatory for all new houses to incorporate water harvesting structure during construction. डॉक्टर देवेंद्र होचंती जने प्रतिष्ठाता सदस्य ऑक्सीजन नामक एक एनजीओ रो जो एनजीओ एक असंभव काम को संभव करी देखैची छत्तीसगढ़ राज्य बिलासपुर पाखरे एक मृत नदी को पुणी जीवन दान देकी। मु जेतबेले ए विषय भाबुची बा आमे जेतबेले ए विषय भाबिबा आमे निश्चित भारे कृतज्ञतारे आम मन भरि जीवो जे आम गहरे एभଳି लोक सब अछंती एभଳି आश्चर्यजनक काम सब करी देखौचंती एवं केवल आमे नुहे आम सारा पृथ्वी एतपई एभଳି व्यक्ति मान पाखे सदाबले ऋणी रहिबो। आजिर टॉपिक होची जे डेल्विंग डीपर इनटू डाइजेस्टिव सिस्टम बा पाचन प्रणाली विषय गभीर अध्ययन। आमे समस्त जानिचंती जे भल स्वास्थ्य आरंभ होची भल पाचन प्रणाली, कारण मनीष गोटे लिविंग ऑर्गेनिज्म हिसाब रे आमे बंची रहिया पे हेले हमको दरकार खाद्य एवं सेथरे थिबा पोषक तत्व। तेणु आम जहाँ खाऊँ जदि ठीक भाव से जदि पाचन है हजम है ताहले सी आमको नरिशमेंट जोगाए संगे संगे आमको रोग संगे लड़िया पे शक्ति जोगाई थाए तेबे डॉक्टर देविंदरंग भली जने विशारदंग उपस्थित रे मु आ ए विषय किछि गोटे मिनिट भी नष्ट न करी मु चाहिबी तांको ठारू सुनिया पे एवं एटा हम समस्त पई बहुत काम आसे आम जो बयस भी था ना कहीं पिला ही थाऊ बा आम जड़े वयस्क व्यक्ति था आम एटा बहुत उपयोगी तेणु ओवर टू डॉक्टर देविंदर वेलकम सर वेलकम टू यू काइंडली स्टार्ट योर प्रेजेंटेशन
Thank you, Sunil Bhai. Thanks for the kind words. I really feel honored for all that you have spoken about me. I'm not too sure how worthy I am of your words, whether I have matched your words, but we'll certainly try to match whatever you have expected of me, you have told about me. Growth is an ongoing process. I mean, grow we never imagined at that age when we were in schools. Srinivas Bhai was 1 year senior to me, and he was a role model that time. Sainik school join we are so happy for him. Has done so well, and after so many years, courtesy this social media, we could reconnect. And when I reconnected with him, I really learned how great work he is doing and all of you are doing. And the way you take children to Koraput for the Sky Vision to guide them about the solar system. I really feel very happy about all that. You're doing a marvelous work. My task for this evening is to take you to a brief journey into digestive system. Se bisare pura depth sabu kichi kohaiba is not possible in such a short span of time, but I will give an overview of the things jaha bhi possible, and then I will give some specific inputs into certain developments which has happened over the years, the way digestive system has evolved. Hindi re gote emti saying ochi which is even partly relevant today. पैर गरम पेट नरम और सर ठंडा डॉक्टर आए तो उसके सर पे मारो डंडा. That means one who has warm feet, a soft tummy and a cool head, he doesn't need any doctor. That is partly true even today. ओडिया जदि कहबी जदि पेट नरम गोड़ उषुम अछि आओ मुंडा ठंडा, that means you don't need any doctor. That is by and large will sort out all your health problems. And yes, a digestive system which was earlier thought to be used to move around few churans and few medicines has gone much beyond that. And now we have seen that it is a game changer of many conditions, many diseases, and taking care of the digestive system will take care of the entire health in a good way. That is the new understanding we have. I'll briefly take you through the journey, how it has evolved, how some of you said it, but I will certainly leave, because of the paucity of time, we'll leave a lot of unanswered areas, and I expect कि आपण माने किछि क्वेश्चन पचारिबे और whatever interests you. किंतु सबुठु आगरु मो जो क्वेश्चन मते चारिटा क्वेश्चन खंडे आसीतिला श्रीनिवास भाई पठै दिले. फर्स्ट वाज छोट पिला मानकर खाउथिबा मा क्षीर पाटिरु बाहरला लाळ को हजम हेबा आरंभ करि दिए. कारण कोन? लाळ ही हजम कर दिया स्टार्ट कर दिए काहे कि because the lalo itself contains an enzyme, digestive enzyme, which is known as salivary amylase. This amylase actually digests carbohydrates, and children at that age, they are taking mostly carbohydrates, and whatever milk, mother's milk which is there, the carbohydrate part starts getting digested from the time that the child has sucked mother's milk. Because it has an enzyme called salivary amylase. Second question was, Surya Kiran or Upasthiti digestive system upar prabhav pakaye ki? Yes, certainly. By way of vitamin D. Kemiti. Peta vitare samastankara bacteria thanti, all of you know that. That's somewhat we talked about is a microbiome. Microbiome are the microorganisms which are inside the human body all the time. Party re no thai, food pipe re no thai, stomach re bhi praya no thai, but as we move downwards, small intestine re, large intestine re, prochur matra re bacteria thanti. Se bhitru two type of bacteria thantu, one are good bacteria and the others are the bad bacteria. That balance of good and bad bacteria is something which maintains the healthy status of an individual. Exposure to sunlight promotes development of good bacteria in human body, and that positively impacts good health of everyone. So exposure to sunlight in a regular basis improves the biological microenvironment inside the digestive system and promotes good health. ସେଥିପାଇଁ ଆପଣ ଦେଖିବେ ଅନେକ जो डेली वेज वर्कर माने थांती सेमाने खरारे काम करंती सबुबेले they by and large remain healthy. Of course they also fall sick, but by and large they remain healthy. And तांको immune mediated diseases गुड़ा हुए नहीं, inflammatory disease हुए नहीं, infective है पारे because of lot of things, tuberculosis हुए, infections हुए, किंतु inflammatory disease गुड़ा हुए नहीं because of abundant vitamin D by way of regular exposure to sunlight. That is one thing. Then माँ क्षीर अपेक्षा गाई छेली क्षीर शिशु मानकर सहजरे हजम हुए नहीं because छेली क्षीर and गाई क्षीर इतने किसी protein थाए and those proteins are allergens for a newborn. Because of that allergy तांको reaction हुए तांको हजम हुए नहीं. So in many countries there is a universal rule that for the first year of life children will not be fed anything other than mother's milk. Allergy. So because of this we feel that to avoid that allergy which is caused by proteins inside the mother's milk हमें शिशु मानकु प्रथम वर्ष में केवल मां को क्षीर प्रमोट करू. Other thing is that वयस्क मानकर हजम कम हुए काहे कि विशेषतः महिला माने wind formation अधिक हुए because as we grow our digestive enzymes they come down, carbohydrate intake goes up many times, inactivity is another issue जो गुड़ा हजम हुए नहीं एटा बैक्टीरिया एक्टिविटी है करी gas production हुए wind formation हुए that is part of aging and महिला माने टिक कम physically active रहती बड़ा वयस रे that is one reason that it is there. Now we start the presentation. Can I have the next slide, please? This is a brief overview of digestive system. As you see, it starts with mouth, and which has plenty of salivary glands, then esophagus, moves on to stomach. As it enters duodenum, there are other points of interest, other organs of interest like liver, gallbladder and other biliary system, pancreas behind it. Then small intestine, the 6 meters long organ. Then we move on to the large intestine, rectum and anus. So this is an overview just for revision purpose. I have shown this. All of you know this. And the primary function of mouth is chewing. Of course, digestion also starts right from there. The carbohydrate part starts getting digested. Esophagus has got no digestive function at all. It just pushes the food from mouth into the stomach. But yes, there are certain diseases which can prevent digestion by way of not delivering food into the stomach properly. सेठी रही जाए तापरे एसिड एक्सपोजर रे अल्सर्स हुए वो टिके परे से विषय कहबी कोन डिजीजेस गुडा इसोफेगस रे हुए एंड ताकू केमती हमें प्रिवेंट करिबा. स्टमक रा गुडा फंक्शन, द फोरमोस्ट फंक्शन इज टू चर्न द फूड, मिक्स करिबा ताकू पूरा जेमती मिक्सी रे पूरा घंटी दिया हुए सेमती चर्निंग एंड मिक्सिंग करा हेबो and then it will be mixed with digestive juices and will be delivered into the small intestine for further digestion. Small intestine, the peristalsis way, that is the primary function. Of course, the digestive juices start acting in small intestine in a big way. All carbohydrate, protein, and fat, they start getting digested in the small intestine. Pancreas produces digestive enzymes in addition to insulin and glucagon. Liver does not produce any digestive enzyme, but it aids the digestion by alkalinizing the food so that the acidic component of the stomach is taken care, and subsequently the food, when it traverses through the small intestine, this acid doesn't harm any part of the intestine. And large intestine, again, it pushes the food forwards. It produces fecal matter from whatever residue that is remained after digestion. These are the primary functions, but it's a very simplifying organ, I tell you. Digestive system gote emti jaga, emti system achi which believes in simplifying things, as we have learned in this complex era. जो जिनसों को जितने सिंप्लीफाई करा हुए सेते बोलो एक्सेप्ट हुए, बॉडी भी सेमिति ही एक्सेप्ट करे. Whatever complex nutrients that you would consume, everything will be simplified into the simplest forms of nutrition, and then it will be absorbed. Like protein gets converted to amino acids, fats to fatty acids and glycerol, carbohydrates to simple sugars. The other functions, of course, are guarding against infections by production of local antibodies, regulation of immunity, again by way of controlling the microenvironment and maintaining a healthy microbiome for overall well-being. Kichi common disease bisare kotha heba. I'm sure many of you would love to hear about these things, but I'll briefly tell you about these. Taku broadly categorize ame kori pariba, whether they are acid related, contaminated food related, bloodborne, alcohol related, immune mediated, metabolic, infections, genetic, এবং অন্য অযথা যার কিছু কারণ আমাকে জানা নাহি. There are a lot of conditions of that type also. Acid exposure ରୁ କ'ଣ ହୁଏ? ସମସ୍ତେ ବହୁତ commonly କହି ଦିଅନ୍ତି acidity ହଉଛି, but every acidity told by lay person is not acidity. ଅନେକ ଲୋକ ଆସି କହନ୍ତି ଗ୍ୟାସ୍ ହଉଛି. Now on day to day experience I can tell you, ଯଦି କେହି ଜଣେ ଆସିକି କହୁଛି ଗ୍ୟାସ୍ ହଉଛି, that doesn't mean that ଗ୍ୟାସ୍ ହଉଛି. When I inquire a little deeper, କିଏ କହିବ ନା ମୁଣ୍ଡ ବିନ୍ଧୁଛି, କିଏ କହିବ ନାଇଁ ମୋର ହାତ ଗୋଡ଼ ବିନ୍ଧୁଛି, କିଏ କହିବ ପେଟ ଫୁଲୁଛି, କିଏ କହିବ ନା ଛାତି ପଡୁଛି. All these things are termed as simply gas, broadly spoken as gas. It's not like that. This is a misconception. Similarly, acidity is also somewhat misconception. But I find I get a lot of patients from Odisha. They are by and large better informed. They are better informed and they can explain their symptoms in a much better way as compared to people who are coming from other sides or even locally. GERD is a very, very common disease. GERD means gastroesophageal reflux disease. Stomach re jaha bhi content thai, food or otherwise, reflux esophagus ko aase, reflux means it's coming back. And whatever symptoms that it causes is called GERD. The commonest is common language, common English language, heartburn. Heartburn में कौन हुए? Center part of the chest gets a burning sensation. It goes down to the upper part of stomach. It can go up to the throat also. Regurgitation, खाद्य पदार्थ ऊपर को फेरी आसे पड़े आसे. Sore eructation, खोटा ढेकुर आसिबो. Eructations will keep coming. These are specific symptoms, and then there are many other non-specific symptoms. कारो केवल throat irritation हुए, कारो जितने सकाळे उठती voice change हो जाए, कारो chest pain भी हुए. These are less common symptoms. And how do we treat it? Commonly we treat by lifestyle as well as dietary advice, and then suppression of acid. Suppression of acid कौन? जितने भी acid production होते हैं, there are an excellent category of medication which are termed as PPI, which has changed the entire scenario. Sorry. ଯେତେବେଳେ ଆମେ MBBS କରୁଥିଲୁ, ଯେତେବେଳେ ଆମର internship ହଉଥିଲା ବୁର୍ଲାରେ, lot of patients used to come with peptic ulcer and all these things. प्रति OT रे 7-8 peptic ulcer operation गुड़ा होतिला. କିନ୍ତୁ ବର୍ତ୍ତମାନ ଆଜିକାଲି ଓଟିରେ କେବଳ ଗୋଟେ ଦୁଇଟା ହୁଏ କିମ୍ବା ହୁଏ ବି ନାହିଁ. And what has changed this? This change has been brought in by PPIs, proton pump inhibitor drugs, the ones which reduce acid production. Say acid production komichi, people have started using these drugs in a big way. Peptic ulcer incidence has come down. The other miracle which happened was identification of one bacteria called H. pylori. So H. pylori bacteria, this was actually discovered by one young scientist from Australia. So he was an intern. He just noticed something, went deeper into it, discovered this H. pylori bacteria, and it was found that this is the one which is responsible for all these complicated peptic ulcer problems, like causation of ulcers, like causation of cancer in the stomach also, some cancers. ଯେତେବେଳେ ସେ H. pylori eradication कर दिया हुए ताकू antibiotic द्वारा ताकू eradicate कर दिया जाए, then people do not get these peptic ulcer disease. There is significant drastic reduction in incidence of peptic ulcer. Say acid exposure जदि prolonged way, untreated रहे for years and years and years together, and people get complications. And what are those complications? Very dreaded complication is the cancers of esophagus and stomach. आउरी कौन हुए esophagus टा पूरा narrow ही जाए, narrow एक खाद्य पदार्थ भीतर को जाए नहीं. We treat it endoscopically ताकू जो narrowing था ताकू narrowing को हमें मेला कर दो, dilate करो. Cancer of esophagus of course requires treatment in form of surgery if possible, if not possible by chemotherapy or radiotherapy depending on whatever is there in the biopsy. Similarly, stomach cancer also depends on if it is early, then of course surgery can be done. R0 resection. In terms of cancer surgeries, we always talk about R0. R0 means there is no residue around the operated site. जहाँ ऑपरेशन कोई काट दिया गला तार आखो पाखरे आउ किछि भी रेसिडुअल कैंसर नाही. That is the perfect resection. But जदि हे जाए, then people improve significantly, they live a long life. आम देश में stomach cancer टा बेसी common नाही. In Japan it is very common. Then contaminated food related problems, diarrhea. हमको बहुत भलो लगे हमें जदि बाहर गुपचुप खाओ, झालमुड़ी खाओ, but all that food is not necessarily contamination free. Because people, the poor thelawalas who are serving those, they do not have a good idea about hygiene. Many times they serve you contaminated water, so we get a lot of problems. Diarrhea is the commonest thing. Contaminated food or drinks besi because of rainy season and other water related problem. Say season besi hue. The other thing is hepatitis. ସବୁ ପ୍ରକାର hepatitis contaminated food ରେ ହୁଏ ନାହିଁ. Hepatitis A हुए और hepatitis E हुए. Hepatitis A छुआ मानकु हुए usually 18 वर्ष रो कम एज रे, जो माने 18 रो बेसी तांकु hepatitis E is the commonest hepatitis related to contaminated food. Other is typhoid, and of course food poisoning, all of you know. So the stale food rahila, contaminated food rahila, then food poisoning हुए. Individually, if somebody asks, I'll explain about it. Then kichi digestive disorders हुए because of blood-borne contamination. रक्त रे किछि viruses carry हुअन्ति. One is viral hepatitis B, the other one is viral hepatitis C. एगुड़ा blood-borne disease. जदि काहाकु contaminated needle syringe द्वारा prick हैला, जदि काहाकु contaminated blood transfuse करागला, और जदि सेथिरे ब्लड हेपेटाइटिस बी नॉन हेपेटाइटिस सी रो वायरस अछि ताहेले तांकु वायरल हेपेटाइटिस बी और सी हेबार संभावना बहुत अधिक. और जते मन जाको हुए तांकु क्रोनिसिटी हेबार बहुत संभावना रहे. क्रोनिसिटी मींस इट लास्ट बियॉन्ड 6 मंथ्स. एक्यूट और क्रोनिक हेपेटाइटिस रे डिफरेंस होची 6 मंथ. जो हेपेटाइटिस ता 6 मास रो कम टाइम रो अछि ड्यूरेशन रो ताकु को एक्यूट हेपेटाइटिस. जो हेपेटाइटिस टा जो वायरल हेपेटाइटिस टा 6 मास रो बेसी लास्ट करे ताकू भी से chronic hepatitis. And chronic hepatitis subsequently goes on to develop cirrhosis of liver and in a significant proportion of people liver cancer also. So blood borne dita हमको मने रखियो कथा. There are many other smaller or minor infections also, but then these are the common ones. Alcohol is a big social menace. Society रे बहुत problem करे, starting from road traffic accidents, marital discords, and lot of other issues. It impacts very badly the GI tract. केमिति alcoholic hepatitis करे तो माने बेसी मद पियंती तांकू jaundice हुए. jaundice ହେଇकरी acute liver failure हे पारे, subacute liver failure हे पारे, chronic liver failure भी हे पारे. pancreatitis हुए. pancreatitis कौन? pancreatitis रे directly जायकरी alcohol ताकू damage कर दिए, and by damaging the pancreas we can get pancreatitis, which is very severe condition and people lose life. Pancreatitis is, I tell you, you will be surprised to know that acute severe pancreatitis is 30 times more serious than heart attack. Nowadays, heart attack people do not die. Most of them survive. Mortality is just 1 to 2%. But acute severe pancreatitis, in best of the centers, 30% people die. Such a bad disease caused by alcohol, of course. And then alcoholics usually do not eat well. They develop malnutrition. They also develop cancers of various parts of the body. Cancer of liver, cancers of pancreas, cancers of the GI tract. These are the cancers caused by alcohol. Immune mediated. There's a lot of talk about immunity in this era of COVID. COVID रे समस्ते immunity विषय में बहुत कुछ सीखिले, नुआ नुआ कथा जानिले. Immunity, either it is hyperimmune response or hypoimmune response, both way, or a disordered immune response. It can lead to hepatitis, which we say autoimmune hepatitis. Otherwise, inflammatory bowel diseases. Duta common disease ଅଛି Crohn's disease or ulcerative colitis. It will be immune mediated हुए. And the third one is pancreatitis. Now, these are the common ones which are caused by immune mechanisms. Next, we come to metabolic diseases. Metabolic diseases are one of the most common diseases nowadays in Western world. Why? Western world रे गोटे अलग type of malnutrition अछि. Poor countries रे, third world countries रे जो malnutrition अछि, that is because of lack of nutrition, lack of nutrients in their diet. Protein, energy, malnutrition हुए. Very common because आमर जो unfortunately poor जो population अछि, ସେମାନେ ତାଙ୍କର diet रे majority रे carbohydrate थाए, protein बहुत कम थाए. So if they are not taken care of properly by way of protein supplementations, they develop protein energy malnutrition. But in the Western world, there is a problem of plenty. They consume too much of calories, too many calories. This too many calories leads to obesity. This obesity has association with fatty liver. Now, fatty liver occur. This is one of the most common liver disease in the world. Presently, it is the commonest liver disease in the world. The who occur? Fat deposit है liver पर. जब the liver fat deposit हुए, and we grade it accordingly कि कितने fat deposit है जी, and accordingly, if fat is deposited for a long time and it is not taken care, then these patients develop similar liver damage the way an alcoholic will develop. Alcoholic fatty liver and fatty, simple fatty liver, non-alcoholic fatty liver, so it is very bad to stay obese, very bad to stay fatty, because you may develop significant problem. And fatty liver, they not only have risk of dying from liver diseases, they have got very high chance of dying of cardiovascular diseases. 28% risk बढ़ी जाए of death from heart attacks or from paralysis. तांको risk बढ़ी जाए for development of cancers of other parts of the body also. तांको risk बढ़ी जाए for development of liver damage also. So fatty liver is something which involves all part of body. So we must take care of fatty liver. I'll tell you how. Next, asila infections. Just like other infections, these infections involving other part of body. Since the tuberculosis primarily lung को involve करे, किंतु पेट रे भी tuberculosis हुए, and it is also treated similar in a similar fashion as we treat the pulmonary TB. Helminthiasis again because of contaminated food, and viral infections guda hue. Even COVID also has got significant impact on liver problem. Then comes genetic. There are certain genetic disorders also. I will not go into too much of details. Pancreatitis is one, and then some cancers which have history of predisposition because of certain presence of certain oncogenes, and these oncogenes actually famous development of these cancers in the body. And then certain unknown etiology are there, like irritable bowel syndrome, again an extremely common disorder. Whatever people refer to as gas, acidity, amoebiasis, all these are actually irritable bowel syndrome. And then there are other functional diseases. But another very important disease which has actually come up recently is drug-induced GI problems. Okay, कौन सी जिनिस पाई मेडिसिन खाउछंती ता द्वारा पेटरे नुआ प्रॉब्लम स्टार्ट हे जाउछि. गिलोय इज टाइनोस्पोरा कार्डिफोलिया. लोके बहुत खाइले, एते खाइले तांकर इम्यूनिटीटा पूरा डिसऑर्डर्ड हे गला. तांकर बॉडी रे एंटी स्मूथ मसल एंटीबॉडी जाके लिवर को अटैक करे, सेटा बहुत बेसी मात्रा रे तयारी हैला भितरे. एंड बिकॉज ऑफ दिस पीपल डेवलप्ड इम्यून मीडिएटेड लिवर डिजीज. Amar got a study achi. We have conducted a study of 86 patients. It is a multi-center study. KEM Hospital Mumbai, Medanta Delhi, Global Hospital Mumbai, Max Hospital Delhi, more center Apollo Hospital Bilaspur. I missing got a study to Korichud where we have found that giloy causes some serial health related issues. So if any one of you who are still consuming giloy, just be careful that continuous consumption for a long time can lead to difficult problems. And in fact, 2 of my patients died because of this giloy consumption. Our study is being published very shortly. It is already submitted. What are the tools available to us? Gastro GI disease ପାଇଁ ଯାହା tools available ଅଛି ଆମ ପାଖରେ. This is one speciality ଯୋଉଥିରେ କେବଳ କଥାବାର୍ତ୍ତାରେ ଆମେ ବହୁତ ଜିନିଷ ଜାଣି ପକଉ. I mean, just by taking a history. So I need to talk. I need to see the patient. Just by communicating with the patient, a lot of information comes, and this information will actually help me make the diagnosis. COVID period, all of us were not touching patients for obvious reasons. Tathapi, somehow we are able to, take care of majority of the things. So a good history, clinical examination, laboratory imaging, investigations, endoscopy is the game changer tool. Endoscopy is the game changer tool. Gastroenterology had got advanced like anything. Baharu dekhiba jaha bhitrur entirely different. Onek thara history re jaha no bahare endoscopy re we are able to get a lot of things. I'll tell you how. Then came advanced endoscopy. Agudo asila kon upper GI endoscopy kebala food pipe, esophagus, stomach, duodenum dekhautila. तापरे लोअर जे एंडोस्कोपी रे कोलोन देखा होतला. कोलोन को एग्जामिन करी ता भितरे जहां भी अल्सर अछि, पॉलिप्स अछि, कैंसर अछि, जहां भी we were able to see and diagnose it, take biopsies from that area. But now this is an era of advanced endoscopy. By advanced endoscopy I mean that we are able to deliver treatment also. जो जिनिस गुडा जो थेरेपी गुडा ऑपरेशन करी सर्जरी करी करा जाउतला, now we are doing all that just by endoscopy. Endoscopy through onek instrument pura jauchi. We are able to take out the tumors. We are able to do the surgeries. We are able to deliver therapy also. We are able to take care of obstructions. जो tumor द्वारा obstruction हे जाउची, knowledge जदि narrowing ulcer है narrowing हे जाउची, even those things are taken care by this advanced endoscopy. Then another new baby in the block is the third space endoscopy. Now third space ta kon? First space hochi the lumen of intestine. Esophagus to start korigri anus porjento. That is the first space endoscopy that we did. Second space hochi liver bhitar ku jiba, bile duct bhitar ku jiba. That is second space endoscopy. And third space endoscopy asila kota. Third space is mucosa tolaku. That ଯଦି କିଛି ଟ୍ୟୁମର ଅଛି ମ୍ୟୁକୋଜା ତଳକୁ, we are reaching there also. ମ୍ୟୁକୋଜା କଟ୍ କରି ତା ତଳକୁ ଯାଉଛୁ, even we are taking out the tumors from there. Achilles cardia is one problem. ଯେତେ କ'ଣ ହୁଏ, lower esophagus ର ମସଲ ଗୁଡ଼ା ପୁରା ନ୍ୟାରୋ ହେଇଯାଏ। ତାକୁ ଟ୍ରେଡିସନାଲି କ'ଣ କରାଯାଉଥିଲା, सर्जरी करी ओपन करी ताकू कट करी से नैरोड मसल्स को सेपरेट करी द पैसेज ऑब्स्ट्रक्टेड पैसेज वाज बीइंग क्लियर्ड, किंतु वर्तमान simply by endoscopy we are doing that. So these are the endoscopic surgeries which are being done. Another very important aspect is, the modern aspect is obesity surgery. जो मैंने अति obese जाकर BMI 35 रु बेसी, they require obesity surgeries, जाको बेरियाट्रिक्स कहा जाए। तो बेरियाट्रिक सर्जरी कौन कर जाउतिला, सेतिरे स्टमक रो ल्यूमेन को छोटा कर दिया जाए। By doing that we were actually reducing the total food intake. से सर्जरी टा भी एबे एंडोस्कोपी द्वारा पॉसिबल अच्छी है। And the other tools are of course medications, and the newer therapies now even in advanced cancer is immune therapy. Immune therapy re, we believe, you see, in many diseases there is a concept of placebo healing. The placebo healing ta कौन? Placebo healing is, जैसे एक placebo healing एक concept है जिसमें कि कुछ लोग बगैर किसी दवा के भी ठीक हो जाते हैं। When you have a very positive intent, आपको लगता है कि मैं कहीं गया हूँ, मैंने भगवान के दर्शन कर लिए, अब तो मैं ठीक हो ही जाऊंगा। तो वे कैसे लोग ठीक होते हैं? They get because there are certain pro-health hormones inside body. वो सारी हार्मोन स्टिमुलेट होती हैं, वो सारी साइटोकाइंस स्टिमुलेट होती हैं, और उनकी वजह से आप ठीक होते हैं। सो दिस इज द नेचुरल हीलिंग प्रोसेस। जंगल में बहुत सारे जानवरों को तकलीफ होती है, चोट लगती है, बीमार होते हैं, वो अपने आप ठीक हो जाते हैं किसी मेडिसिन के बगैर भी। व्हाई? बिकॉज देयर इज समथिंग कॉल्ड नेचुरल हीलिंग प्रोसेस। और वो कैसे होती है? दैट इज मीडिएटेड बाय इम्यूनिटी। इफ द इम्यूनिटी इज गुड, then this placebo healing takes place. And there is another part of it which is called nocebo illness. That means when you are going to a place taking medicines and you have no belief in that medicine, that many times these medicines do not work. So faith, belief and trust, these things are very important to achieve healing. And based on that, this immunotherapy, because in immunotherapy we modulate the immunity in such a way that the pro-health cytokines and hormones are increased, and then targeted immune therapy is delivered even in advanced cancer cases. Besides other inflammatory conditions also, these people do improve. And then in inflammatory conditions we have biologics. Biologics are again a group of medicines जिससे जो इन्फ्लेमेटरी प्रॉब्लम्स होती हैं, जैसे रिमेटॉइड आर्थराइटिस है, जैसे जीआई ट्रैक्ट में अल्सरेटिव कोलाइटिस है, क्रोन्स डिजीज है, ये जो होती हैं इनमें बायोलॉजिक थेरेपी परफेक्ट हीलिंग स्टेटस को अचीव करने में मदद करती है। सो दीज आर द न्यू टूल्स अवेलेबल टू अस। नेक्स्ट वन प्लीज। अब मैं आपको थोड़ा सा ओवरव्यू बताता हूँ एंडोस्कोपी के बारे में, कैसे ये होती है। देखिए, जब हम अपर जी एंडोस्कोपी करते हैं, पेशेंट को लेफ्ट लेटरल पोजीशन में लेटाना होता है, और जैसे आप देख रहे हैं, जैसे ये सबसे पहले जो एक कार्टून डायग्राम बना हुआ है, इसमें इसोफेगस जो है येलो पोर्शन, नीचे वाला पोर्शन जो है कार्डिया बिल्कुल इमीडिएट नजदीक वाला हिस्सा उसका होता है, जो स्टमक का ही पार्ट है, पार्टली इसोफेगस में रहता है। देन द एंटायर स्टमक, इसको देखा जाता है, ड्यूडेनम को देखा जाता है, फर्स्ट एंड सेकंड पार्ट को। सबसे पहले हम स्टार्ट करते हैं, हम देखते हैं लैरिंग्स। इसलिए बहुत सारी कंडीशंस ऐसी होती हैं जिसमें कि लैरिंजल, या जिसको हम वॉइस बॉक्स भी कहते हैं, उसके एग्जामिनेशन से स्टार्ट होती है अपर जी एंडोस्कोपी। फिर हम आगे जाते हैं, इसोफेगस को देखते हैं, जो एंडोस्कोपी वाली सेकंड पिक्चर है उसमें। उसके बाद स्टमक में एंटर करते हैं, फिर उसको रिवर्ट करते हैं, एंडोस्कोप को जे मैन्यूवर कहते हैं, जे शेप में बदल जाता है एंडोस्कोप। और जैसे ये ऊपर ब्लैक देख रहे हैं आप, ये ब्लैक जो है ये एंडोस्कोप, इन्वर्टेड एंडोस्कोप है ये। उसके टिप में लाइट सोर्स होता है, उस लाइट सोर्स से ही हम उसको लाइट फोकस करते हैं। जो इमेज बनती है वो सीसीडी चिप होता है, उसके अंदर वो इमेज स्टोर होती है, जाके प्रोसेस होती है वीडियो एंडोस्कोप में। तो जो इमेज हम देखते हैं वो वर्चुअल इमेज होती है, दैट इज नॉट रियल इमेज, दैट इज अ वर्चुअल इमेज। उसको देख के then we are able to identify whatever pathology is there. ये सारी नॉर्मल पिक्चर है, एक नॉर्मल अपर जीआई एंडोस्कोपी की पिक्चर्स हैं. Why I showed it to you? I showed it to you that ये जो नॉर्मल पिक्चर वाली एंडोस्कोपी है, इसके बावजूद कई लोगों में पेट के सिम्टम्स होते हैं. एंडोस्कोपी की सब कुछ नॉर्मल निकला, इसके बावजूद किसी को एसिडिटी महसूस हो रही होती है, किसी को जलन हो रहा होता है, किसी को दर्द हो रहा होता है. These things are possible even with a normal endoscopy. And there are a variety of causes because of that. It could be a functional problem, it could be a dietary issue, it could be a stress thing. So जो भी है, this is the way we delve into the upper GI tract by way of endoscope, and then we have a look. Next one please. ये जैसे मैंने बताया वीडियो प्रोसेसर इमेज जाती है और वो एंडोस्कोप के टिप में लाइट होती है, वहां से वो रिफ्लेक्शन से लाइट जो पड़ती है वो थ्रू फाइबर ऑप्टिक्स जाके प्रोसेसर में पहुंचती है. और ये फाइबर ऑप्टिक्स के बारे में एक इंफॉर्मेशन मैं आप लोगों को देना चाहता हूँ. ये फाइबर ऑप्टिक्स को जो इन्वेंट किया था एक इंडियन ही थे, अमृतसर के रहने वाले NS कपानी. And Dr. Kapani was a very eminent physicist. He migrated to United States, California, way back in early 50s. And उन्होंने ही ये फाइबर ऑप्टिक्स को इन्वेंट किया था कि लाइट कैन ट्रैवर्स थ्रू दिस टॉर्चुअस fiber optic cables. There are millions of cables which actually are joined together to form this endoscope. Next one please. ये एक ERCP में कर रहा हूँ. ERCP is endoscopic retrograde cholangiopancreatography. इसमें बाइल डक्ट के अंदर स्टोन्स बहुत सारे दिख रहे हैं. जो एक्सरे की पिक्चर दिख रही है आपको, टॉप वन इज मी परफॉर्मिंग ERCP. जो उसके नीचे वाली पिक्चर है, जो लेफ्ट साइड की फिल्म है जिसमें CBD स्टोन नीचे लिखा हुआ है, उसमें जो ऊपर से आया जो लॉन्ग ट्यूब है दैट इज द एंडोस्कोप. एंड उसके साथ जो ट्यूबुलर स्ट्रक्चर है जिसमें बीच में कुछ कुछ ब्लैक गैप्स दिखाई दे रहे हैं, वो सारे स्टोन्स हैं. वो स्टोन्स आर बीइंग सीन एंड उन स्टोन्स को फिर एंडोस्कोपी के द्वारा निकाला जा रहा है. ERCP के द्वारा यू आर एबल टू सी दैट द स्टोन्स आर बीइंग रिमूव्ड. राइट साइड में जो 4 पिक्चर उनमें आप देख रहे हैं एक वायर की बास्केट है, उससे स्टोन को पकड़ के बाहर निकाल दिया जा रहा है. दिस इज द वे वी रियली एंटर डीप इनटू द biliary system by way of endoscopy support and take out these stones. These stones were earlier being removed by open surgery. Open surgery करके किया जाता था. Patient used to remain in hospital for about 14-15 days with a huge long cut in the stomach. But अब वो without admission OPD basis में इसको हम करते हैं. And then patients जो morbidity है, हॉस्पिटल में रहने की ट्रबल्स है, उन सब से बचता है. नेक्स्ट वन प्लीज. What other things we do by endoscopy in GI diseases? The first picture is which is showing EVL. इसमें दो फिल्म है. इनमें जो लेफ्ट साइड वाली है, दिस इज शोइंग ए स्पर्टिंग वेसल. तेज धार खून की बहती हुई नजर आ रही है आपको. दिस इज स्पर्टिंग वेसल which is actually pouring out blood. And if this bleed will not be stopped in time, the patient will die. What we do, we ligate it with rubber band. ये जो उसके राइट साइड की जो पिक्चर देख रहे हैं आप, इसमें एक बैरल के ऊपर रबर बैंड्स हमने लोड किए हुए होते हैं. वी गो एंड फायर दोज रबर बैंड्स ऑन दैट ब्लीडिंग एरिया सो दैट इज लाइगेटेड. जैसे सर्जरी में पूरा ओपन करके खोल के उसको लाइगेट करके बांध के ब्लड रोका जाता था, दिस वी आर डूइंग जस्ट बाय ligating these blood vessels, the bleeding vessels, by putting rubber bands on that. Then उससे जस्ट नीचे जो हमारी पिक्चर है उसमें EST कर रहे हैं. वी आर इंजेक्टिंग स्क्लेरोजिंग एजेंट्स इनटू द ब्लीडिंग एरिया. एंड दिस स्क्लेरोजिंग एजेंट स्टॉप द ब्लीडिंग फ्रॉम व्हिचएवर प्लेस इट इज टेकिंग प्लेस. एंड इसमें वी इंजेक्ट लॉट ऑफ थिंग्स. वी इंजेक्ट अदर एब्सोल्यूट अल्कोहल और वी इंजेक्ट some chemicals known as sodium tetradecyl sulfate, or sometimes sclerosing agents, the adrenaline also, because depending on the site and the disease involved. Then we have some powders also. ये पाउडर को स्प्रे करते हैं. स्प्रे करने से जहाँ से ओजिंग हो रही थी, बहुत सारी जगह से ओजिंग हो रही है, पाउडर स्प्रे करते हैं और ब्लीडिंग इमीडिएटली स्टॉप हो जाती है. दिस इज कॉल्ड हीमो स्प्रे पाउडर. दिस इज अनदर ब्यूटीफुल थिंग्स नाउ व्हिच सेव्स मेनी लाइव्स. उसके नीचे लास्ट में जो APC लिखा है, दैट इज एक्चुअली आर्गन प्लाज्मा coagulation. इसमें क्या करते हैं, we deliver argon gas into the area at a specified wattage. उससे क्या होता है, जो ब्लीडिंग एरिया होता है वो बर्न हो जाता है, वेसल जो है कोagulate हो जाती है and bleeding stops. Next one please. Now these are some stents which are the real game changers nowadays in digestive diseases. अलग अलग एरिया में स्टेंट हम अलग अलग रीजन से डालते हैं. जो इसोफेजियल स्टेंट डाला है सबसे पहला ऊपर वाला टॉप मोस्ट वन ऑन द लेफ्ट साइड इज एन इसोफेजियल स्टेंट. व्हाई इट इज पुट देयर? इट इज पुट बिकॉज ऑफ कैंसर ऑफ इसोफेगस. जब इसोफेगस का कैंसर हो जाता है एंड देयर इज ऑब्स्ट्रक्शन, द आइडियल थिंग इज दैट उस ऑब्स्ट्रक्शन को हम सर्जिकली रिमूव कर लें, दैट इज द बेस्ट थिंग. लेकिन मेनी टाइम्स, रादर मोस्ट ऑफ द टाइम, पेशेंट्स रिपोर्ट लेट. हमारे पास सर्जरी का ऑप्शन रहता ही नहीं, बिकॉज दिस कैंसर हैज स्प्रेड वेल बियॉन्ड दैट एंड इट इज नॉट फेवरेबल फॉर सर्जरी. देन वी पुट इन अ स्टेंट व्हिच इज एक्चुअली मैश ऑफ वायर. जो तार की जाली होती है बिल्कुल फोल्डेड, जस्ट अ फ्यू मिलीमीटर में फोल्डेड होती है, बट वंस वी पुट इट इन प्लेस, जैसे कार्डियक स्टेंट होते हैं वो खुल जाते हैं, जैसे ये भी जाके अंदर खुल जाता है. खुल के इट क्रिएट्स अ ल्यूमेन सो दैट पेशेंट कैन ईट वेल. इसके बगैर पेशेंट खा नहीं पाता, पानी भी नहीं पी पाता, बिकॉज ऑफ द ट्यूमर्स ऑब्स्ट्रक्टिंग पैसेज, खाना भी नहीं खा पाता. ऐसे ही जब बाइल डक्ट में ऑब्स्ट्रक्शन होता है तो जॉन्डिस हो जाती है, ऑब्स्ट्रक्टिव जॉन्डिस. वहां पर भी हम स्टेंट डालते हैं, जॉन्डिस कम हो जाती है. सिमिलरली ड्यूडेनम में, फूड पाइप में पेप्टिक अल्सर होता है. पेप्टिक अल्सर जब हील होता है, इट कॉजेस लॉट ऑफ स्कारिंग, ऑब्स्ट्रक्शन. वी पुट इन द ड्यूडेनल स्टेंट, रास्ता खुल जाता है, वॉमिटिंग कैन स्टॉप. Colonic stent, again, if there is obstruction in colon because of whatever reason, whether it is cancer or any fistula also, we put in this colonic stent and the obstruction is relieved. Chronic pancreatitis में अगर stone obstruction कर रहा होता है, in that case we bridge that obstruction by putting stent even in the pancreas. This requires very highly skilled endoscopy और सभी centers में नहीं होता है, and this also saves a lot of surgical problems. Next one, please. The other significant development over the last 25 years has been in India is liver transplant. The liver transplant program, जब से ये इंडिया में आया है, it has really transformed life of so many people. Cirrhosis of liver is a disease which actually leads to liver failure. और इसकी वजह से क्या होता है, पेशेंट्स progressively develop complications and they die. Similarly, many of these people, they go on to develop liver cancer. Cirrhosis of liver and liver cancer, if detected in time, if they get liver transplant, then they survive for a long time. Liver cancer को अगर हम ऑपरेट नहीं करते, ट्रांसप्लांट नहीं करते, people die in few months only. जबकि ऐसे पेशेंट्स हैं हमारे जिनका हमने लिवर ट्रांसप्लांट आज से 20 साल पहले कराया था बिकॉज ऑफ लिवर कैंसर. दे आर स्टिल सर्वाइविंग. सिमिलरली सिरोसिस ऑफ लिवर, आई गॉट ट्रांसप्लांटेड a child of 9 years of age. She came to me with one disease called Wilson disease with liver failure. She was dying. This was in 2007. उसका liver transplant कराया and she's still surviving. She's about to get married next year. This is the way life have changed. This is the way we are able to bring lot of positivity in the field of digestive health. Next one. So there are certain game changers in various hepatic disorders, various digestive disorders, I would say. In hepatitis B, the game changer has been vaccine. जिसको hepatitis B का वैक्सीन लग जाता है, उन्हें hepatitis B नहीं होता है. And by preventing hepatitis B, we are not only preventing acute hepatitis B infection, but we are also preventing cirrhosis of liver. We are also preventing liver cancer. So this vaccine, hepatitis B vaccine, in fact, अगर आप लोगों में से किसी ने नहीं लिया, I think you should all take it because it's a real game changer. Hepatitis C is extremely common in Western world. Hepatitis B Southeast Asia में, चाइना में बहुत common है. हमारे यहाँ तो around 4% लोगों को होता है. Hepatitis C हमारे यहाँ पर इंडिया में about 1.7 to 1.9% लोगों में ही होता है. But once infected, people go on to develop cirrhosis of liver and then they die. In Western world like America में, Europe में, hepatitis C was extremely common. because hepatitis C is not only transmitted through blood, but it is also transmitted through infected needles and syringes. So intravenous drug abusers जो हैं उनमें बहुत commonly ये पाया जाता है. And many people used to die because of hepatitis C related liver disease and cancer. But antiviral drugs which have come to market for last about 12-13 years, they have changed the game. Now hepatitis C is curable. We can cure more than 95% of cases. This is a real game changer, and the life of so many people have been saved because of this. Alcoholic liver disease में क्या करें? Absolute abstinence. If it's not being done, at least moderation of alcohol intake is must, because excessive alcohol intake will lead to damage of liver. अल्कोहल के बारे में एक मैं अपने पेशेंट्स को जो एग्जांपल देता हूं, मैं यहाँ भी आपको बता देता हूं, क्योंकि अगर आपके भी कोई जानने वाले हैं कि चिन्ह जोड़ा अछंती, you can quote the same example. Now, a lot of people keep drinking alcohol, then they don't die, they don't get diseased. काहे की? कौन हुए? समझ कुछ हुआ नहीं. It is genetically transmitted. So the susceptibility to alcoholic liver disease and cirrhosis is genetically transmitted. Some genes are protective and some genes are there which can actually cause more harm. Of course, it is not very clearly established. किंतु बुझेगा भाई समझाने के लिए आप ये कह सकते हैं उनको कि जिस तरह से लकड़ी एक बार जल के कोयला बन जाती है और वापस आग बुझने के बाद भी लकड़ी नहीं बनती, ऐसे अगर आपका लिवर एक बार अल्कोहल से डैमेज होके कोयले के बराबर खराब हो गया, उस समय अगर अल्कोहल छोड़ेंगे आप, तब भी अल्कोहल से होने वाली प्रॉब्लम से आपको मुक्ति नहीं मिलने वाली. You still have problems. So before it turns into coal, you better stop. This way, a lot of people get convinced, they get scared, and they leave alcohol. और जैसे cirrhosis of liver हो जाती है because of any of the above three reasons, the game changer, the savior, of course, is liver transplant. Next one, please. IBD, inflammatory bowel disease, जैसे मैंने बताया, ulcerative colitis, जिसमें कि खूनी दस्त होते हैं, मोशन में खून आता है, पेट में दर्द होता है, प्रोग्रेसिवली वेट लॉस होता है. इनमें बायोलॉजिकल मेडिसिन आने के बाद जो है द सर्वाइवल, द सफरिंग बोथ हैव रिड्यूस्ड वेरी सिग्निफिकेंटली. GERD, गैस्ट्रोइसोफेजियल रिफ्लक्स डिजीज, इसमें H. pylori eradication से और लाइफस्टाइल मॉडिफिकेशन से, जिसमें कि खट्टे खाने से भी बचना होता है. वी हैव टू अवॉइड साइट्रस फ्रूट्स, वी हैव टू अवॉइड ओवर ईटिंग, वी हैव टू अवॉइड excessive consumption of tea, coffee. This is taken care. Peptic ulcer, the game changer is H. pylori eradication. Fatty liver, commonest disease of mankind, commonest liver disease of mankind. इसमें weight management and exercise is extremely important. Weight management कैसे? अगर आप overweight हैं, तो you must reduce your weight by about 8 to 10% over next 3 months. And then again, you fix another target, similar target for next 3 months. This way, once you achieve your optimum BMI, that is of 24.9 in case of males and 23.9 in case of females, so that you achieve an optimum metabolic status of your body. Advanced cancer mein, the game changer is going to be immunotherapy, still being worked out. Dysbiosis क्या होता है? जो हमारी बॉडी के अंदर के बैक्टीरिया का बैलेंस जो है बिगड़ जाता है. Harmful bacteria becomes more and helpful bacteria becomes less. उसको कैसे ठीक करना है? Again, by exercise, by healthy diet and healthy habits. Surprisingly, saturated fats होते हैं, जैसे कि मक्खन है, देसी घी है, इनके खाने से हमारा डिसबायोसिस इंप्रूव करता है, हमारे हेल्दी बैक्टीरिया अच्छे हो जाते हैं, बढ़ते हैं. दिस इज न्यू फाइंडिंग. बट जो दूसरे ऑयल्स हैं, वेजिटेबल ऑयल्स हैं, उनमें डीप फ्राई किया हुआ कुछ अगर आप खाओगे, then dysbiosis worsens. And because of this dysbiosis, lot of disease take place. Lot of big problems come up. Like patient ठीक हो रहा है हॉस्पिटल में, suddenly he gets septicemia. Somebody who has got some other disease like cardiac problem, because of certain factors, he will develop dysbiosis, then his cardiac condition also worsens. A lot of immune conditions, they also worsen because of dysbiosis. Fatty liver, dysbiosis has got a very important role. GERD, dysbiosis has a very important role. All these things are they somehow are getting correlated with dysbiosis nowadays. इसको कैसे हमने ठीक करना है? By exercise, by healthy diet, by healthy habits. By healthy habits means taking meals on a timely basis. Breakfast around 8, lunch around 1 to 2 p.m. and dinner before 8 p.m. These are the healthy habits, healthy eating habits, I would say. Then never overeat and exercise every day. These are certain healthy things which promote healthy bacterial environment inside the body. Next one, please. Well, that suffices. I have actually exceeded time. I'm already clocking 9:09 p.m. I'm sure there are a few people who are still there, still around. That's all in very brief about the digestive system. And if there are any questions, any queries, it will be a great pleasure on my part to answer those queries. Sunil Babu, please go ahead and thank you.
Dr. Devinder, thank you very much for a wonderful presentation. जदि कहार कौन सी जदि प्रश्न थाए ताहले आपण माने पचारि पारंती जेमते हम कथावार्ता होतले डॉक्टर देविंदर को आपण जो लैंग्वेज आपण कंफर्टेबल आपण सेही लैंग्वेज पचारन.
Sir, I have a question. Is this process is called translocation in plant?
Well, I am not a botanist. All I would say is that food passes through the esophagus is just a transfer mechanism. It has got no digestive function. So the passage of food is just translocating food from mouth and delivering into the stomach for further digestive actions. For plants, I would be extremely happy if someone who has good knowledge of botany would throw some light on this.
ठीक है जो कौन पचारन
सर, जैसे कि हम लोग के पास डाइजेस्टिव सिस्टम है, प्लांट के पास क्या डाइजेस्टिव सिस्टम है?
प्लांट के पास है, बिल्कुल है.
डाइजेस्टिव सिस्टम का नाम क्या है सर?
अच्छा पिला माने आज हमें मनीषर डाइजेस्टिव सिस्टम विषय प्रश्न पचारले हमें ठीक उत्तर पाई परिबा.
ओके, ठीक है सर. सर जेमते कि हम बॉडी रे एंजाइम सिक्रेट हुए फॉर डाइजेशन.
Yes.
तो हम जानछु जे एंडोक्राइन सिस्टम रो हार्मोन भी सिक्रेट हुए जे कि कंट्रोल एंड कोऑर्डिनेशन को प्रिफर करे. तो एमिति किछि डाइजेस्टिव एमिति किछि हम डाइजेस्टिव सिस्टम रे एमिति किछि पार्ट अछि कि जो पार्ट रो बोथ हार्मोन भी सिक्रेट होछि आ एंजाइम भी सिक्रेट होछि.
पैनक्रियास रो दुटा सिक्रेट. पैनक्रियास रो कौन है? हार्मोन हुए, इंसुलिन, ग्लूकागॉन और जो डाइजेस्टिव एंजाइम होती है पैनक्रियाटिक एमाइलेज, पैनक्रियाटिक लाइपेज, ये गुण सिक्रेट हुए. सो दैट इज वन ऑर्गन व्हिच सिक्रेट बोथ.
सर गोटे ऑर्गन रे दीटा जिंस सिक्रेट होछि सेठी किछि प्रॉब्लम होबनी? तार भीतर किछि इंटरकनेक्शन
नहीं, अलग सेल अछि ना. पैनक्रियास दुटा पार्ट अछि. एंडोक्राइन पार्ट अछि. एंडोक्राइन पार्ट रो हार्मोन सिक्रेट होछि, जति अल्फा सेल, बीटा सेल गुडा अछि. And then there is exocrine part. So exocrine part अछि सेठी रो एंजाइम रो सिक्रेट.
सर हमें केमते जानिबो जे हम जो फूड हमें गेन करछु से फूड को डाइजेस्ट करे पई केते एनर्जी दरकार?
गोटे बेसल मेटाबॉलिक रेट थाए. बेसल मेटाबॉलिक रेट कौन? Basal metabolic rate is the basic energy expenditure जो हम हुए for conducting the basic functions of human body. दूसरे की हार्ट बीट अछि, रेस्पिरेशन अछि, अदर फंक्शंस अछि, से सबुतरे एनर्जी लागे. सेति पाई we need some calories even if we are doing nothing. हम किछि करूनु, we are just lying down. सेते बेले हमको किछि कैलोरी दरकार. सेते डाइजेस्टिव फंक्शन भी इंक्लूडेड अछि, but separating it out from other physical activities, other basic activities of being alive, that may not be possible. कि digestion में केते एनर्जी लागु छी, हार्ट बीट केते एनर्जी नउ छी, कि निश्वास नेबा में हमको केते एनर्जी लागु छी. whatever we need is basically at least 30 calories, 30 kilocalories per kg body weight हमको दरकार पड़े for survival. से भितरु किछि कैलोरी डाइजेशन पाई भी दरकार पड़े.
से बर्तमान कोरोना टाइम रे हमको किसी सजेशन एमती आसिला जे you go for increasing B12 level so that that would help your immune system. So how far this is correct? And the other thing is that what is the role of fermented foods in our diet?
First thing first, vitamin B12 was, there were a few studies, there are a lot of people who got infected and then they survived. And a lot of people who got infected and they did not survive. So these two data, when they analyzed, they found that those who did not survive had the deficiency of vitamin B12 levels in a higher percentage, have a higher proportion of cases. But this is not something which has been duplicated in other studies also. यदि कौनसी गोटे फाइंडिंग टा बारंबार स्टडीज रे डुप्लिकेट हुए नहीं, then that does not become the guideline for treatment in subsequent patients. To become a guideline, it has to be duplicated in all experiences. समस्त यदि के जने देखिला B12 बेसी रोइले लाभ होची, supplementary लाभ होची, I should also see that. Somebody sitting at Bhubaneswar also should see that. Somebody who is practicing in Chennai or Washington or London should also have similar experience. Semiti hela nahi. So this is just an observation which doesn't have a solid ground. But yes, immunity is certainly helpful. But immunity ko jinso dwara improve kare. Immunity improves with a balanced diet. Immunity improves with a good regular physical activity in form of exercise or yoga even. Immunity improved with a perfect balanced nutrition and of course a healthy sleep habit, a healthy daytime work habit. यदि आपण 4टा सकाळे ब्रेकफास्ट करूछंती 8टा रे 9टा रे और लंच करूनांती संध्या 4टा 5टा रे करूछंती, even that also impacts your immunity. But we always look for certain shortcuts. एटा खाइदेबा immunity बढ़िया ही जीव, किसी आयुर्वेदिक किसी बटिका खाइदेबा भलो ही जीव, विटामिन सी खाइदेबा भलो ही जीव. It doesn't happen that way. Immunity is a complex issue. It is a result, it is an end product of so many other things besides nutrition, besides vitamins, besides these short-term prescriptions or whatever drugs which we are getting in the market.
सुष्मिता मैडम कोन पचारुचंती आपण
सर नमस्कार सर राउरकेला कहूली
आज्ञा कोन
सर ये मो जो उषुम पानी पीले नख उषुम पानी एटा कोन गैस रो किछि मो पाई किछि रेमेडी की
गैस रो रेमेडी हुआ बेसिकली अल्प उषुम पानी पीले की असुविधा नहीं, लाभ टिके हुए कोन पेरिस्टालसिस इनिशिएट हो जाए. कारी पेरिस्टालसिस होची इंटेस्टाइन रो नॉर्मल मूवमेंट आपण जानि पारिबे ने एटा भीतर मूवमेंट हुए से पेरिस्टालसिस इनिशिएट हेले आपनकर गैस भी भलो पास हुए, झाड़ा भी परिष्कार हुए, पेट भलो रहे. कारी उषुम पानी अल्प उषुम पानी पीले से पेरिस्टालसिस इनिशिएट हो जाए. Because of that you feel good, soft in your abdomen, you are able to pass good motion and you are also able to release gas. किंतु गरम पानी पीबाटा अति खराब. कोरोना टाइम रे अनेक लोक कौन कले गरम पानी पीवा आरंभ कर देले कि सेतरे किछि मिक्स कले, अनेक जिंस अदा मिसेले कि दालचीनी मिसेले, अनेक जिंस कले. All these things proved out to be very bad. बहुत पेशेंट को गैस हैला, बर्निंग हैला, they ended up getting investigated in a big way. अनेक जिंस इन्वेस्टिगेशन हैला, chest pain सेतरे हैला. So warm water, lukewarm water, fine, you can take it. It does not help in digestion. Yes, of course, it promotes peristaltic activity. If there is a gas trap inside anywhere, it will be passed. आपनको भलो लागिबो. Only that much, nothing more, nothing less.
सुष्मिता मैडम कोन तो आपण प्रश्न आपण हैंड रेस करछन्ती पचारंतो. आउ विज्ञान चेतना मंच ओडिशा तरफ मु आपनको धन्यवाद जणाउची. आशा करछि पुणी आसंता दिन मानकरे आपण हमको एमती किछि नुआ टॉपिक विषय हमको ज्ञान देबे आउ आमे आपण ठरो से सब जिंस जानी गोटे सुस्थ निरामय जीवन यापन करिवो. मु अनुरोध करछि श्री सिद्धार्थ बाबू को टू एक्सटेंड द वोट ऑफ थैंक्स. सिद्धार्थ बाबू ओवर टू यू.
सर बहुत बहुत धन्यवाद. बहुत सुंदर आलोचना ହେଇଛି ଆଉ ତା ସାଙ୍ଗରେ ପ୍ରଶ୍ନ ଉତ୍ତର ବି ବହୁତ ସୁନ୍ଦର ହେଇଛି ଆମେ ଜଣେ ଭଲ ରିସୋର୍ସ पर्सन फ्रॉम मेडिकल फील्ड पाइଛୁ ତେଣୁ ସାରଙ୍କୁ ପ୍ରଥମେ ତ ଧନ୍ୟବାଦ ଦେବି ଦେବେନ୍ଦର ସାରଙ୍କୁ ଏବଂ ସୁନିଲ ସାର ଅତି ସୁନ୍ଦର ଭାବରେ ଏଟାକୁ ପରିଚାଳନା କରିଛନ୍ତି ଏବଂ ସମସ୍ତ ପାର୍ଟିସିପେଣ୍ଟ ଏଟାକୁ ମାନେ ଏଥିରେ ଆକ୍ଟିଭଲି ପାର୍ଟିସିପେଟ କରିଛନ୍ତି ତେବେ ଆମେ ଏଇଟାକୁ ମୁଁ ମନେ ପକେଇ ଦେବି ଯେ ସାଇନ୍ସ ଡେ ଇଜ ଅନ୍ 28th February and we are observing a science week and this is a part of that talk of science week and that will continue. Our next talk will be on magnetron upare amar next talk rahibo Srinivas sir engineer Srinivas das eta talk rakhibe ତେଣୁ ମୁଁ ସମସ୍ତଙ୍କୁ ପୁଣି ଅନୁରୋଧ କରିବି ସେଥିରେ ଜଏନ୍ କରିବେ ତାଙ୍କର ଇଏ ସେୟାର କରିବେ ପିଲାମାନଙ୍କୁ ବିଶେଷ କରି ସ୍କୁଲ କଲେଜର ପିଲାମାନଙ୍କୁ ଆଟ୍ରାକ୍ଟ କରିବେ so that they develop a questioning mind questioning attitude gradually କେମିତି develop କରିବ ସେଇ ଆମର ହଉଛି ମାନେ ଆମ ଟୋଟାଲ ବିଜ୍ଞାନ ଚେତନା ମଞ୍ଚର ଯୋଉ ମାନେ ଆମର ଆଭିମୁଖ୍ୟ ଥାଏ ଯେ to create a questioning mind ମାନେ questioning everything around us. So with that, I thank Devender sir, Sunil sir, and all others. Let us call it a day. Thank you. Thank you, sir.
Thank you. Have a great time. Good night.
Thank you, sir. Thank you.
Thank you, Dr. Devinder.